How government-run healthcare systems like the one in Canada not only deny but also delay care for weeks, months, even years. By focusing on just one hospital in one city in Canada, Kingston General in the city of Kingston, Ontario, we can begin to get a glimpse of the effect that government-run healthcare has on everyday Canadians and the long waits they routinely endure for necessary care. Now, I have no doubt that the politicians in Canada never intended for the people of that country to see their health care denied or delayed. I'm sure the intention was to make health care even more accessible and affordable than it was. But as we've seen so many times in our own country, government solutions have a tendency to create barriers instead of bridges. The unintended consequence becomes the norm. That's what happened in Canada, and Americans are concerned it could happen here, too. A medium-sized city of about 115,000, Kingston, Ontario, has about the same number of residents as Lansing, Michigan, to its south. But while it's not uncommon for Americans to receive medical care within days of a serious diagnosis, at Kingston General Hospital, wait times can be staggering. Take hip replacement surgery, for example. A couple of years ago, the wait time for hip replacement surgery at Kingston General was almost 2 years. Well, a lot of people were understandably unhappy with the fact that they had to wait more than a year and a half between the time a doctor said they needed a new hip and their surgery to actually get it. So the government worked to shorten the wait. Today, the average wait time for the same surgery at the same hospital is about 196 days. Apparently, in Canada, the prospect of waiting 6 months for hip surgery is considered progress. That's hip replacement surgery. What about knee replacements? Well, at Kingston General, the average wait is about 340 days, or almost a year from the moment that the doctor says you need a new knee. How about brain cancer? In Ontario, the target wait time for brain cancer surgery is 3 months. 3 months. Same for breast cancer and for prostate cancer. And for cardiac bypass surgery, patients in Ontario are told that they have to wait 6 months for a surgery that Americans often get right away. The patients at Kingston General Hospital in Kingston, Ontario, have been understandably unhappy with all the waiting they have to do. Take the case of Shona Holmes, a Canadian citizen who was told by the bureaucrats running the healthcare system in that country that she'd have to wait 6 months to see a specialist to treat her brain tumor. Here's how Shona described her plight. If I'd relied on my government, I'd be dead. Shona's life was eventually saved, fortunately, because she came to the United States for the care that she needed. With her vision deteriorating, she went to the Mayo Clinic in Arizona, and the doctors there told her that immediate surgery would be needed to prevent permanent vision loss and maybe even death. Meanwhile, the government-run system in Canada would have required more appointments and more delays. Ms. Holmes got the treatment she needed when she needed it here in the United States. Now, the American people want health care reform, but creating a government bureaucracy that denies, delays, and rations health care is not the reform that they want.